Welcome back. Joining me this morning is Dr. Jason Church from the Ogden Clinic. We've been talking about this virus, the Enterovirus that's been going across the country. And first of all, tell me a little bit about that. And is it something that we expect will eventually make its way here to Utah?
Yeah, the enteroviruses circulate during spring, summer, the warm months. It's definitely going to make its way here.
This is a typical virus that we see, but you say this one's just a little bit more severe, some of the symptoms that we're seeing in the patients.
Yeah, it's not unlike the common cold, the rhinovirus, but the Enterovirus 68 that we're hearing a lot about especially affects kids and especially affects those with underlying problems like asthma.
So those of us with children, you know, this is something we always, our ears kind of perk up when we hear stuff like this and some of the severity of the symptoms. What can we do as parents to try to protect our children?
Well, the typical step that we usually do, avoid those who are sick, try not to send our kids to school if they're not feeling well, especially if they're having fever. If we have a child who has asthma or an underlying health problem, I would be a little more reserved and conservative about sending them to school once we hear that this virus is hitting Utah.
And it seems like the difference between this virus and the others we're seeing is simply the severity of some of the symptoms that we're seeing. So basically, as you were telling me, I mean, these viruses, once you get them, they just kind of have to run their course through your system, so it's best just to try to treat those symptoms that you're seeing?
Yeah, for sure. Like most viruses that cause respiratory illness, we need to try and treat it at home as best we can. But those kids that are having difficulty breathing, wheezing, definitely get in to see your pediatrician if it's severe enough to the ER.
And you said already you're getting quite a few calls about this.
We are,
people.
Definitely.
Dr. Church, we appreciate it, and always important, consult your pediatrician. Dr. Church is with the Ogden Clinic. We'll have all the information on our webpage. We appreciate you making time for us this morning. I expect we'll be hearing more about this virus in the upcoming weeks. Dr. Church, thank you. Appreciate it. Emily?